So now let's talk about multidisciplinary teamwork, right? Working in teams. Remember that CHW is a part of the care team. CHWs don't work by themselves. CHWs tend to always work under the supervision of someone else, and they are part of the entire care team. So, multidisciplinary teamwork involves collaboration among professionals from different backgrounds to provide comprehensive care that improves patient outcomes. And usually the teams consist of professionals from different disciplines that are working together to provide comprehensive patient-centered care. Remember, it's always about the patient, and each one who's a part of this team provides a unique expertise. And the big role that CHWs have on the team is to bridge gaps between the healthcare provider and the communities that they serve. So, an example of a multidisciplinary team is a primary care physician who diagnoses and oversees medication treatments, making referrals as needed. Also, a nurse and pharmacist support the medical treatment plan. The CHW provides culturally competent outreach and education and patient navigation. There's a dietitian, a physical therapist, and behavioral health specialist. There's also a social worker or case management. So all of these individuals are on one team working together to help solve the patient's problem. So let's look at a case study of a multidisciplinary team in action. We have Maria Lopez, 52. She is diagnosed with type 2 diabetes, hypertension, and obesity. Her challenges are uncontrolled blood sugar, food insecurity, transportation issues, and difficult managing medication. And on the multidisciplinary team, there's a primary care physician, a nurse practitioner, a community health worker, a dietitian, a pharmacist, a behavioral health specialist, and a social worker. So the primary care physician is the one who's going to be prescribing the insulin, monitors the progress, and refers to specialists. The nurse practitioner teaches blood sugar monitoring and insulin use. The community health worker provides home visits, arranges transportation, and connects Maria to food resources. The dietitian develops a culturally appropriate meal plan. The pharmacist educates on medication adherence and side effects. And then the behavioral specialist supports emotional well-being and refers Maria to diabetes support group. And then the social worker helps with the financial assistance and healthcare navigation. And the outcome with everyone working together, Maria gains the tools to manage her diabetes, improving her health and reducing hospital visits. So some key characteristics of effective team-based care is really to understand understand that it needs to operate with structure, respect, and everyone needs to have a common goal. Obviously, the common goal is to be patient-centered, person-centered, or client-centered, right? Focusing on the client to get the client better. That's the ultimate goal. There are some following characteristics that defines a strong, effective teamwork. So a shared vision and mission. So all team members work together towards a common goal of improving patient care and the public health. So every professional understands how their role contributes to the bigger picture. Role clarity. Each team member understands the responsibilities, strengths, and limitations. Clearly defined scope of practice ensures that CHW and other professions work within their expertise. Open and respectful communication. So effective teams encourage collaboration, ask questions, and actively listen to each other. CHWs must communicate with both healthcare providers and clients to ensure patients' needs are met. A culture of unity. Team members value each other's contribution and support interdisciplinary cooperation. So CHWs are recognized as valued members of the healthcare team rather than being seen as assistant or informal workers. Growth opportunities, ongoing training and professional development keep team members up to date. Best practices, CHWs receive continuous education to enhance their knowledge in patient care, cultural competencies, and health navigation. And then also to measure processes and outcomes. So teams set clear goals and metrics to track patient care improvement, and CHW can collect community health data to assess the impact of the program and interventions. When we look at what is the role of a CHW on these healthcare teams, A CHW serves as a trusted liaison between the healthcare professional and the community. So they may provide outreach, they provide communication, they provide patient education, they also provide person-centered case management, chronic condition management, medication management, and also they might conduct home visits as well. Some of the challenges that are found within teamwork is, despite all the advantages of having a CHW and all of the advantages of working together, team members may face obstacles that really hinder the effective collaboration. One of the biggest one is hierarchies, right? Traditional medical hierarchies may undervalue CHW, limiting their ability to contribute fully to a care plan. Some healthcare professionals may not see CHWs as equal partners, reducing their influence in decision making. There also could be a lack of information and understanding of a CHW's scope of practice. So some healthcare teams are unaware of what CHWs can and cannot do, leading to underutilization or role confusion. CHWs may be asked to perform tasks outside their scope of practice, creating ethical and legal concerns. Also, workload equity. CHWs often have high caseloads leading to burnout and reduced effectiveness. So lack of clear delegation may result in some team members taking on more responsibilities than others. So some successful strategies for effective teamwork. So how to overcome challenges and maximize collaboration within a healthcare team should establish clear roles and responsibilities. So really pushed for all team members to really define their scope of practice, including ensuring that CHWs are included in decision-making processes. Also promote interdisciplinary training, so providing cross-training opportunities and making sure that other providers understand that CHWs are valuable, and also encouraging mutual respect and learning across disciplines. There's always something to learn from everyone. Anyone on the team, there's always something to learn from. Also to strengthen communication channels. So, use team huddles, case meetings, or share documentation to improve coordination. Encourage CHWs to share patient insights that providers may not be aware of. Also to encourage collaboration over hierarchy. So instead of focusing on who is the lead and all these different things, really focus on how can we collaborate. In the same sense is, if that is the culture, as someone coming into that culture, you need to respect that culture. It is what it is. I know it's horrible and I know you want to fight against it, but at the end of the day, if that is the culture, it is our job to figure out how to navigate that culture. So, ideally, CHWs will be recognized as equal partners in patient care. And also, it should be encouraged to open feedback too of all team members, including CHWs. Also, to create workload balance, so distribute caseloads fairly to prevent burnout, and to provide CHWs with support and supervision to ensure they can manage their responsibilities effectively. So some key takeaways is CHW serves as connectors between the healthcare system and communities. Successful teamwork relies on clear communication, defined roles, and mutual respect. CHWs must advocate for their values to be fully integrated into the healthcare team, and addressing challenges like hierarchies and workload imbalance can improve collaboration.